An amiable welcome to everyone. This is our Allied Lecdem channel to enhance your understanding. Today's topic is about heart sounds. Heart sounds are noises generated by heart valves in association with blood. Here is our normal heart sound. You heard two sounds. The first one lap sound is S1 and the second one dap sound is S2. For better understanding and correlation, take a look on our previous video cardiac cycle. Auscultation. The sounds of the heart is heard with the help of instrument called stethoscope. The chest piece of stethoscope has diaphragm and bell. The diaphragm part is used to measure high-pitched sound, whereas the bell part is used to measure low-pitched sound. For auscultating heart sound, there are various areas. In the picture, the orange point notes the aortic area, which is present at the second intercostal space, right sternal border. The green one is tricuspid area present in fifth intercostal space, left sternal border. Blue one is mitral area present in the same fifth intercostal space but mid-clavicular line. Purple one is pulmonary area in second intercostal space, left sternal border. The reason for choosing these area will be cleared shortly. S1. The first heart sound, the lap sound, produced at the beginning of ventricular systole, otherwise called as isovolumetric contraction. We all know that it is caused by closure of atrioventricular valves, which is tricuspid and mitral valve. But there is a concept behind it. Normally during systole, the intraventricular pressure exists more than the atrial pressure. The blood from ventricle tries to escape into atria, but the valves in between them prevent the backflow. During this function, the atrioventricular valve bulges into atria and the chordae tendineae supports and helps to maintain the closure of valve in association with papillary muscle. This sudden tensing between the valve and chordae tendineae produces a vibration which is carried by blood and exert in heart and chest wall. The main point of this vibration is heard as lap sound, and that is how the S1 is produced from the result of reverberation. S1 pathology. Normally, the mitral valve closes first and the tricuspid valve takes just a bit longer time to close. In certain pathological conditions like right bundle branch block, Epstein's anomaly, right atrial myxoma, and all the right-oriented pathology condition, the tricuspid valve takes much longer time than the normal. This results in S1 split. S2, the second heart sound, the dap sound, caused by closure of semilunar valve called aortic and pulmonary valve, occurs at the end of ventricular systole and beginning of ventricular diastole. This also results from reverberation. S2 split. The red line of the picture denotes the aortic valve closure. The blue line of the picture denotes the pulmonary valve closure. Like mitral and tricuspid valve, after the closure of aortic valve, the pulmonary valve closes. But during inspiration, the pulmonary valve delays in closure as it is associated with pulmonary system. For example, during expiration, the S2 is heard as lup dup, lup dup, but during inspiration, it is heard as lup drup, lup drup. Wide S2 split. The pathological causes behind this was right bundle branch block, pulmonary hypertension, right heart failure, RVOT obstruction called pulmonary stenosis, WPW syndrome. In this condition, the normal physiological condition prevails also during expiration. Example, during expiration, the wide split is heard as lup drup, and this pulmonary valve closure extends during the inspiration and heard as lup drup. Fixed S2 split. As the term describes fixed split, the S2 split is fixed during expiration and also during inspiration. This condition is seen in atrial septal defect. Paradoxical splitting. All the previous condition is associated with pulmonary valve closure, but this condition is associated with aortic valve closure, which is seen in aortic stenosis and left bundle branch block. The red colored line denotes the AV valve closure and the blue colored line denotes the pulmonary valve closure. Physiologically, after AV closure, pulmonary valve closes. But in paradoxical splitting, there will be a delay in AV closure, so that the pulmonary valve closes first during expiration. During inspiration, the pulmonary valve closes plus the addition of AV closure delay superimpose each other and the mean lub-dub sound is produced. So, this change is called mirror change of physiological split S2. S3. Normally, there are two heart sounds S1 and S2. But in some cases, S3 can also be heard. So, S3 and S4 are termed as extra heart sounds. Lup dup ta. The ta sound is the third heart sound, which occurs at the beginning of diastole. This stage is called rapid filling stage. During this stage, the blood from atria drops into ventricle. This fast movement of blood produces a vibration and the third heart sound is produced. The S3 is low pitched sound and heard with bell side of the steth. You can see a marker in the picture, which is the fifth intercostal space at mid-clavicular line, symbolizes the apex of heart. It is the best location for hearing S3. S3 is physiologically normal in young adults, athletes during pregnancy and fever, but it can also be pathological in the conditions of poorly contracting LV in DCM and mitral regurgitation. S4. S4 also called as presystolic gallop or atrial gallop, as it is caused during atrial kick stage of cardiac cycle, and the sound will be ta lup dup, ta lup dup. S1, S2, S3 are physiologically normal. The only pathological heart sound is S4. S4 causes systemic hypertension, aortic valve stenosis, HOCM, active ventricular ischemia like recent MI or severe angina. Comparing the extra heart sounds. S3 ventricular gallop, S4 atrial gallop. S3 occurs in early diastole, which is the rapid filling state. S4 occurs in late diastole, which is the atrial kick state. It occurs during passive LV filling, it occurs during active LV filling. S3 may be normal at times, but S4 is always abnormal. S3 requires a very compliant LV, S4 requires a very non-compliant LV. S3 can be a sign of systolic congestive heart failure and S4 can be a sign of diastolic congestive heart failure. S3 and S4 pathology. Quadruple gallop. You can see a quadruple rhythm. The combined presence of S3 and S4 is a quadruple gallop, and this sound is heard as ta lap dup ta, ta lap dup ta. Summation gallop. This summation gallop occurs during tachycardia, where the S3 and S4 may merge to produce a summation gallop. Here the ta sound will be high pitched, like lap dup ta, lap dup ta. Summary. S1 and S2 are normal heart sound, where S1 is heard during early systole and S2 is heard during late systole. S3 and S4 are extra heart sounds, whereas S3 can be normal and may also pathologic, but S4 is always pathologic. S3 happens in rapid filling stage and S4 happens in atrial kick stage. Thank you.